I'm Matt Willis, Marin County Public Health Officer, with an important update for December 23rd. Yesterday, 173 new COVID cases were reported in Marin. This is the highest number on any day since the start of the pandemic. The previous highest count was 167 cases on January 6, 2021. Today, we're on track to equal yesterday's numbers. This pattern of a very rapid rise to record highs is consistent with what we've seen in other areas where the new variant has taken hold, Omicron. This means two things. One, that Omicron is actively circulating in Marin, and we should assume that new cases from here forward are infected with the Omicron variant, and that we should expect to see very high case numbers in every community over the next few weeks. So let's get back to our knowns and unknowns about Omicron. It's clear that this variant is more contagious by a long shot than Delta. Colleagues who have worked at the CDC for decades have commented they haven't seen any virus move as quickly through a community. It's also clear that vaccines in the absence of a booster are not as effective against preventing infections, but are protecting against serious illness. The highly publicized outbreak in Marin last week of a gathering of fully vaccinated people where half were infected is a sign of what we're up against. But most importantly, none of those 30 people infected at that gathering developed serious illness or were hospitalized. We've been saying one of the key unknowns related to Omicron is the severity of disease. But we're learning more, and what we're learning is positive. South Africa and the UK offer the longest intervals of observation and the most complete data about Omicron. After their surge of new infections in South Africa, they're now declining rapidly, and they seem to have plateaued in the UK. Through the surge in both settings, hospital capacity remained adequate. This suggests that by and large, those infected with Omicron were not experiencing severe illness in large numbers. This points to the possibility of a best possible scenario for us, of a rapid rise in cases and a rapid fall over a few-week period as a characteristic of an Omicron surge, and one that may spare hospitals from a surge of critically ill people. It's far too early to know if that best-case scenario is our future, but we are hopeful ourselves, and we have set ourselves up well. Our high vaccination rates are our greatest asset, with nearly 90% of us being fully vaccinated and most of us having had a booster dose. But we also know a booster dose is necessary to be well protected against Omicron. For that reason, the single most important thing anyone can do is to obtain the protection of a booster now. The news of unprecedented case numbers is obviously unwelcome tidings during the holidays and on the eve of Christmas, when our best instincts, and for many of us, our traditions, are to gather together. Marin County Public Health is not recommending against gatherings, knowing how important these are to our well-being, especially this far into the pandemic. But we must recognize more than ever that there are no risk-free options. If you have not had a booster dose, and if you're at higher risk for more severe illness, if you do get infected, consider avoiding indoor gatherings, now that we know Omicron is so active in our community. To protect yourself and our community, if you haven't yet, ask your healthcare provider for a booster shot, or go to getvaccinated.marin.org or myturn.ca.gov. If you are gathering, do a home rapid antigen test the day of the event. Gather outdoors or in a well-ventilated indoor setting, and don't join others if you're having symptoms. The next few days and weeks will be a challenging chapter for us in our pandemic response. We will continue to offer updates and guidance to support that same balanced, science-driven response that our community has carried so well through this pandemic. Thank you for doing your part.